Hello! Today we're going to be discussing the anatomy of the respiratory system or the respiratory system. Now, you breathe in most naturally through your nose. So this cartilaginous structure right here, we're familiar with the nose. The nostrils, we have a nasal septum that goes through it, the nasal bones forming the bridge. But if you looked at a skeleton, you notice, oh, if we were to remove this soft tissue, we have these holes that are heading back deeper into the skull. Well, that's true, and we see that here. This is called the nasal cavity, a large structure that heads much deeper back into the head. This nasal cavity is lined with mucous membranes. Also here in the nasal cavity, we have these kind of bony outcroppings or bony shelves called the nasal concha, also known as the turbinates. From here, air would go to the back of the nasal cavity and then down the back of the throat here, and this is something we call the pharynx. The pharynx heads all the way down, and it is a shared passageway. Air comes in here, this portion called the nasopharynx. Food and liquids come in, this portion called the oropharynx. And then there's this last portion called the laryngopharynx. So we have a mixed bag of what's going on here. Ordinarily, when we breathe, this structure called the epiglottis is open, so air can keep on going down eventually to the lungs. But when we swallow, that epiglottis closes so that food or liquid is forced down the esophagus. So this structure right here, the epiglottis. The epiglottis is attached to this structure right here called the larynx, also known as the voice box, made of a thick cartilage that you can actually feel as you move your finger down. Now from there we move into our trachea, and I'm going to switch models so that we can visualize this better. This model here, so we start off again up here. This is our larynx, and then we come down into our trachea. Notice the ridges, the cartilaginous rings that you can feel along your trachea. And then now that we're here in the thoracic cavity, we split into a right and left primary bronchus. This is what takes air into our right and left lungs, sitting there in our thoracic cavity. But once we split into the primary bronchus, they continue to split into secondary and tertiary, forming this whole what we call the bronchial tree. The bronchial tree is what carries the air all throughout the lungs. So it's not just filling up like a balloon. Instead, the air is contained within all of these passageways all throughout both lungs. Now, at the ends of the bronchial tree are air sacs called alveoli. This is where the capillary beds are. This is where gas exchange will happen. That's, of course, too small to visualize on this model. Now, notice between these two lungs, if I were to reattach it here, we have a space. And that space is called the mediastinum. Now this space is filled in real life. It doesn't stay empty. Our heart is there. You can obviously see that's where the trachea is coming down, where we have some of our great vessels, our esophagus, but that area is called the mediastinum. Also, these lungs aren't just sitting inside our body cavities. Instead, they're lined with a double membrane, nice and smooth and slippery, called the pleura, allowing our lungs to freely move without any kind of friction. And then lastly, we have this great big muscle across the base of the lungs that's called the diaphragm. It's a dome shape. When it flattens, it draws air in. When it domes back up, relaxing, that's when air will go out.